Okay, this video is the history of medicine with regard to like ostracized geniuses. And again, it's a pretty typical story. I just made a video about the situation in dentistry and it's like medicine. Basically, because there's so much money to be made by lying to people, ripping them off, selling them drugs, selling them unnecessary surgery like a CABG, coronary artery bypass graft, coronary artery stents. That's where all the push is, all the promotion, the advertisement. So somebody comes along, has a cheaper treatment. That's not popular. The first guy was Ignaz Semmelweis, and he's the one who figured out if you just wash your hands, the number of women who die in childbirth dramatically is reduced. So something as simple as that, the other doctors were very offended. They used to go from doing dissections in the autopsy area to delivering babies, and they wouldn't wash their hands. And the infection rate of puerperal sepsis was off the charts. All he said is, wash your hands. And that got them so pissed off, he was fired. He ended up getting put in a mental institution and beaten up and died. Okay, that's Ignaz Semmelweis. That's what you get for being a medical genius. Okay, he did a whole bunch of experiments to prove he was right. Otto Warburg, they've tried to hide the Warburg effect, of hypoxia-inducing mitochondrial injury, the metabolic theory of cancer. This guy, Travis Christofferson, wrote a great book called Tripping Over the Truth. Because I had heard of metabolic theory of cancer, but didn't really understand it, hadn't really given it much attention. And then that book got me, looking into it. And he's right. He's totally right. It's a great book. He doesn't know what he's talking about as far as nutrition. He's sort of down that keto trend with Seyfried and all that, but still, it's a great book. Okay, Walter Kempner. Reading Walter Kempner's book is like amazing. You just see cure, 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 cure. In conventional medicine, here's what you see. Train wreck death, train wreck death, train wreck death, train wreck death. Okay, that's conventional medicine for you. And then you go look at Kempner. Train wreck cure, train wreck cure, train wreck cure. It's like, holy crap. He's the grandfather of nutritional therapy. He ran like a nutritional ICU in his rice diet over at Durham, North Carolina at Duke. Okay, so everybody who's serious about nutrition, you should read that. What Dr. McDougall had said is, don't even talk to me about nutrition or debate me unless you have read Kempner and Pritikin. Those are his two most important mentors. Because they both were geniuses and they both did magnificent work. And you can see it. It's an amazing thing to see. Okay, and that's why, low-fat vegan, that's why, people say, oh, why don't I get excited every time some new blowhard comes along and tells me fat is the secret of health? It's like, because I've already read the real work, the real papers, before there was any money in this. And it's pretty obvious low-fat's the way to go. Okay, Dennis Burkitt. Dennis Burkitt, the brilliant work coming up with abdominal pressure syndrome, the Irish Christian missionary to Africa. And I can tell you, one of my uncles, okay, Uncle Willie, William Allen, he was a chief of surgery, okay, at a big hospital. And I actually went over there and did a rotation and trained with him. He did not know about abdominal pressure syndrome, despite the fact him being an Irishman. It was not widely known. This whole Burkitt fiber stuff, okay, and abdominal pressure syndrome. Some people had an idea, fiber is good for you, but they were thinking Metamucil. They didn't know Dennis Burkitt's abdominal pressure syndrome. Okay, and then Dr. McDougall heard a lecture by him about 1972 when he was sort of a resident, and that sort of awakened his mind to the power of nutrition. That and Kempner, it's like, holy crap, and then Pritikin. Gregory Sloop, he's a pioneer of atherothrombosis theory. And talk about things that make blood thicker, increase blood viscosity, predisposed to clotting. Douglas Kalinetha, Pretorius, they're the ones that did the work on leaky gut causing increased bacterial endotoxins, LPS and LTA, causing amyloid transformation of the fibrinogen protein from alpha helix to beta pleated sheet so it becomes prothrombotic. Amazing work, okay? All of these people deserve Nobel Prizes, and none of them will ever get it because Nobel Prizes are not about the quality of scientific work. They are about whether or not corporations want it to be popular. So it's kind of sad. We live in a very corrupt age where, in healthcare, in dentistry, and in medicine, the genius work does not get acknowledgement because they want to keep it a secret from the public. They don't want the public to know they have more power to help themselves than a doctor does with a bunch of lousy pills that don't work. Okay, the diabetes geniuses, Michael Brownlee, Roy Taylor, Gerald Shulman, Richard Moore, he's the guy who figured out the ion pumps in all his years of research and why you need the high K factor, at least 5, preferably 10 or more. Dr. McDougall's work, the starch diet, figuring out leaky gut autoimmune disease, explaining to everybody the blood sludge work of Roy Swank, MS work of Roy Swank, and how stents and open heart surgery don't work, things like that. Cancer survivors long-term like Ruth Heydrich, of course. And he maintained a legacy of people like Dr. Kempner, Dennis Burkitt, Nathan Pritikin, Roy Swank, which otherwise would have been forgotten. Okay, Lorraine Kay. You want to see a genius female? There's a genius female, Lorraine Kay. Lorraine Daay. Lorraine Daay. Watch her videos. They're amazing. The power and the brilliance that comes out of that lady. She's another one of these long-term 40-plus year survivors of metastatic breast cancer. Kelly Turner's Radical Remissions. This Janet Murray, her book Raw Can Cure. Jack Delatorre's Vascular Hypothesis of Dementia is great. The excitotoxin work of John Olney, Russell Blaylock, Catherine Reed, Stephanie Seneff, it's great. The intracranial oxidative stress work, Exley, it's great. Then the psychiatrists who stood up to the drugging method of the field, all of them took a lot of personal and financial hassle because of it. Thomas Schaus, Lauren Moser, Peter Bregan. Lauren Moser was the top research psychiatrist in the whole USA. He figured out you can treat schizophrenia better with just personal attention in residential facilities with no drugs. And man, they came after him. They fired him. That's a big thing to figure out. Those antipsychotic medications are terrible. They all cause lobotomy. They're a relatively rapid onset chemical lobotomy, those antipsychotic drugs. If you go to Dr. Joseph's website, YouTube channel, you'll see videos on how these antipsychotics cause lobotomy. T.C. Campbell, animal protein bad. Anthony Jay's work on popularizing estrogenics as something to avoid, bringing that into people's awareness. His book, Estrogeneration, is magnificent, one of the all-time great medical books. Caldwell Esselstyn's great work on prevent and reverse heart disease. And of course, there's my work on, mechanisms of causing dementia, supply and demand theory, the ischemic and biochemical theories of spinal degeneration, role of mitochondrial inhibitors in disease, and saving the legacy of Gregory Sloop, Richard Moore, Lorraine Daay, and some others. So that's kind of what you do, I'm totally shadow banned, but I'll try to keep alive all this truth, and other people are doing it too. And that's how the truth stays alive, because the truth is weak. It's not that strong. There's not that many people promote the truth. Most of the famous doctors, and some of them are doing it, but a lot of them are, where the money is promoting things like olive oil, okay? The money's not in telling the truth about these low-fat vegan pioneers. So anyways, hope you found that helpful.